Hello there, my lovely. Make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. Could you just confirm your name for me, please? Okay, that's perfect. So what can I do for you today? Alright. You think your ears need cleaning out? Okay. We can do that. Do you have pain? Pressure. Okay. And do you have problems with earwax build-up? Yes, I can see here that you do. You do. Okay. It's very natural for some people to get a build-up quite often. It varies, but you're obviously one of those people that does get that build-up. Okay. You're not feeling unwell in any other way? No recent infections, colds, flus? Okay, that's fine. Do you have allergies at all? Yeah, okay. Perfect. Alright, so I think what I'll need to do first is take a little look at you, alright? Yeah, have a look around the outer ear, down the ear, and then see where we need to go from there, okay? Alright. Do you have an allergy to latex at all? Okay. I'm just going to pop some gloves on. Okay, let me just give the ear a little wipe around. Okay. I'll start with your left side here and just a gentle wipe around just to clean off any dust or debris you may have picked up en route. Okay. Do your other ear now. There we go. Okay, so you've not experienced any pain on your outer ear at all that you've noticed? Okay, well I'll start with your right ear and I'm going to have a little press around first, okay? Tell me if anything's uncomfortable. Alright. Gentle pat around. Okay, I couldn't feel any lumps or bumps. Did that feel okay for you? Good, okay, let's take a look at this side now. Same again. Just a little feel around and some little pats. feels fine. No pain there? Okay, that's good. Have your ears been itching at all? No, they just feel quite clogged and, yeah, just some pressure there. Okay, so I'll need to have a little look down with the otoscope here. I'm sure you've had this done plenty of times. Just a little light on the otoscope and this specular here goes into the ear, okay? Alright. I'm just going to have to pull up and back very gently to do this, okay? Here we go. Right, here we go. Just popping it in now, my lovely. Oh, there is a lot down here. I can't see the eardrum, there's a lot of wax, a lot of impacted wax. You can see it's gone quite dark, so it's been there a while. Just reposition. Okay, I'll withdraw that now. Definitely a big impaction down that ear. Yeah. Yeah, it can be uncomfortable for sure. I'm pretty sure that's what's causing your discomfort. Let me just check this other side. Okay, just going to pull up and back then, my lovely. And insert in the otoscope now, okay. There we go. Same again here. Lots of impacted wax. There's a huge build-up in your ears. Okay. Right, let me take that out of there. Okay, so I think the best way to move forward with this is for me to try and soften that wax and then see how much I can remove by hand, okay? There are alternative methods we can use, but I would rather just try and soften it first, okay? Because there is a lot down there, it might be a little bit uncomfortable, so I'm going to pop you some anaesthetic drops down your ears first, okay? And then I'm going to pop some lovely fizzy drops down, so you'll get all the drops today. Okay. These won't sting, burn. Nothing that I'm going to put down there today will cause you discomfort. I just don't want to make you feel more uncomfortable when I'm removing any wax. Because I'd like you to come back to me if you need to see me again. I don't want to scare you away. Okay. Let's just pop some down here. Right, I'm just going to pop two down here. There's one. And two. Okay. You all right there? Good. And a couple down here. Okay, here's one. And two. Right, I'm just going to check that they're working. I'm just going to gently touch inside your ear with this tool and you can tell me if you can feel it or not. Alright? Okay. Just let me know if you can feel this, my lovely. Yeah? Okay. Right, okay, that's fine. They work very quickly. And this side. You can't feel this? Okay. That's perfect. Okay, let me just update my notes there. Right, let's get my other drops now. Now these are the exciting ones that fizz and crackle. They basically break down earwax. If it doesn't get rid of everything on the first go, I can also put some more in to get a little bit further down. Okay. Right. Let's go with your left one. I'm going to put 3 down. Okay, to start with. Okay. Here's 1. And 2. And 3. Okay. Good, you like the sound? Perfect. Most people do. Feels rather pleasant. You may even start to get some relief from the pressure already. Don't forget your ears are going to be somewhat numb now for a while. Here we go. Here's 1, 2, and 3. Give that a little roll. There. Fizzing nicely. Perfect. Okay. Alright. So I'm going to use this long spoon-shaped tool to start to scoop away the wax, and I'm hoping it will come away without too much of a fight. As I said, I can put some more drops down, but I need to have a little look first to see what I can get, okay? Alright, keep nice and still for me for this. If anything's uncomfortable or you want me to stop, please just pop up your hand. Try not to move your head, okay? Here we go. just have a little look down there now with the otoscope. Okay, just going to put that in. Right, it's still quite solid down the bottom, so I'm going to pop another couple of fizzy drops in. Okay. Right. Are you alright there, my lovely? Good. Right, another couple of drops. One and two. I see you're closing your eyes there. That's nice. Oh, you find it relaxing. That's perfect. Okay, another little scrape around now, my lovely. That's got the rest of that out of there. Just have another little look. Yeah, that's looking better. I just need to give it a little brush up in a few minutes when I've done the other side. I'll let that settle for a bit. Okay. So there's a lot come out of there. I can see your eardrum now, so that's good. I'm just going to have a little go on this right side, see what we can get out of there. Okay? Righty. Okay, and keep nice and still for me, my lovely. Out of there, let's have a little look with the otoscope again. Let's pop that. There we go. A little bit down there. I'll just pop another drop in there. Okay. going to give your ears a little brush now. So I have just a very special little brush which might sound a little loud to you in your ears, but it will just help remove some of the excess little bits that get trapped onto the hairs in your ears, okay? Again, tell me if it's not comfortable for you. Yeah, good, I'm glad you couldn't feel that. Your ears will be numb for a little while. Okay. Right. Let's get the brush. There we go. Okay. How is that? Good. Do your ears feel better now? That's good. Right, you're in for a treat today because you get triple drops. These are just soothing ear drops now. Okay. See how you go. I mean, you'll probably need to come back again if you're just one of those unlucky people that naturally gets a lot of build-up. But any problems in the next few days to a week, if you feel sore, itchy, discharge, any fevers, just come back. But I'm sure you're fine. I can't see any signs of infection. All right. Okay, just a couple of these now. Okay, 1, and 2. Okay, good. And 1, and 2. Okay, so that's you all done. Good, enjoy the rest of your day. I'm glad that wasn't too bad for you. Yeah. So, like I said, we'll see you soon if needs be. But any more problems in the next month or so, up to a few months, just come back to us and we'll take another look at it for you. Okay? Alright then, you take care. Bye-bye. Oh, hello there, my lovely. Make yourself comfortable there. just confirm your name for me? That's perfect. Okay. Right. So I believe you've been having some ear problems. Okay. Yeah. Okay, so past couple of weeks. All right. Have you had any infections at all that you're aware of? No. Okay. Have you got pain in your ears? A little bit of pain. Okay. They feel irritated and a little bit blocked. Okay. Have you suffered with earwax before? Okay. Any hearing loss? All right. And have you been swimming, wearing earbuds a lot? Okay. All right. And have you been putting any Q-tips down your ears at all? Okay, to scratch them. All right. Wouldn't advise that, but that can push earwax further down. Okay. So you've had no sore throats, no respiratory issues at all, and do you suffer from allergies? You get hay fever, okay. All right then. Perfect, okay. Well, let's take a little look at you, shall we? I'll just get some gloves on. It's been a windy old day today, hasn't it? Yeah. We need to get some summer, don't we? Okay. So have you had any headaches at all with this, or pain in your face or in your jaw? Okay. All right. Well, let me just have a little feel around those lymph nodes, okay? Just around your neck, under your jaw, and just behind at the base of your skull. All right? Okay, here we go. Just a little press around. Okay. Nothing painful there? Okay. Right. I can't feel any lumps and bumps there, which is a good sign. All right. Okay. I'll just pop that on the notes. Okay. So I'll have a palpate around the outer ear. All right. Okay. Let me just give a little wipe round there. Keep nice and still, this will feel nice and refreshing, alright? Okay. Just a gentle little wipe. Okay. Alright, perfect. And around here. Okay, so I'll start with your left ear and I'll have a feel around, okay? So I'll just have a gentle press around. Tell me if anything's uncomfortable, okay? And then I'll have a little tug on the earlobe as well, and I'll also look behind the ear, alright? Okay. Alright, here we go. going to look behind. Okay, well, everything looks normal on the outer ear, and nothing was painful, was it, for you? No, okay. Even when I tugged on it? Just a little bit. Okay, let's take a look at your right ear. Okay, do the same here, just have a little look around. Some patting and just me pressing. Just a look behind now. All good. Nothing too uncomfortable there. Perfect. Right, I'm going to take a little look down your ears now with my otoscope. Let's put a new tip on there. Okay. Right. So the tip will just go inside your ear canal and allow me to take a look at what's going on down there for you, my lovely, alright? Okay. Just keep nice and still for me as you have been doing, just because I don't want to cause you any more discomfort. Here we go. Pop that in now. Okay, so what I'm seeing is a wax impaction. It looks quite dark, so I'm guessing it's been there a while, and that's what's causing your discomfort, I'm afraid, but we can get rid of that, no problem. Okay. Ear canal's a little bit irritated, but I would expect that. Yeah, that's what's going on there. I'll just withdraw that now. There we go, well done. Alright there, perfect. Okay, same again on this side, my lovely. Just going to pop the otoscope in now. Okay. Very similar picture on this side. Hardened wax and a slightly irritated ear canal. Yeah. Is that painful? So as I said, I'm seeing this really old looking hard wax down there. Yeah. So it kind of oxidizes, and then what's behind it may be hard, but it may be a lot softer too. But this certainly looks quite old and hard. Okay, and that's what will be causing all that discomfort. Okay. Yeah. Well, I've got some tools here that I can remove the wax with. I've also got this special tool here, which is a endoscope. So it allows me to look inside the ear but also remove earwax at the same time. So it's not a very big tool, obviously, and has this light on it, and I can go in. The images show up on my screen over here, and I can see what I'm looking at as I'm removing it as well. Okay, yeah. So I'll probably use this, but also clean up with a little brush that I've got as well afterwards, which is really rather pleasant. Okay, so we can do that, but first I'm going to pop some drops down your ears just to soften the wax a little bit, because that makes everything much more comfortable. Okay, if it's soft it comes away easier. Obviously if it's hard it can attach and pull a little bit. Alright, okay, so let me find those drops. Right, here we go. So these will fizz and crackle a little bit, just for a little while, as they just break through what wax they can break through at that time. Okay, just need to give them a good mix around. I think you'll like these, most people do. Okay, they look good to me. They separate a little bit, so I just have to make sure that they're all good. Okay, right. We'll start with this left ear. Alright, I'll pop some in here. Okay. Okay. I'm just going to pop 2 drops down each ear, my lovely, alright. Right, here we go. Here's 1. And 2. Okay there. They're fizzing. Perfect. Right. Here's 1. And 2. Let's just let those work their magic for a second or 2. Okay, I'm just going to get the endoscope calibrated. Okay. Right, so that's on now. So it just has this little light and this little tip can help spoon out any wax, as I said. Okay, so let's just get that set up to the screen. Okay, right, keep nice and still for me like before, and please just pop up your hand if you're uncomfortable. Alright? Perfect. So here we go with the endoscope, so I can see what I'm doing as I'm doing it. Okay, here we go, just going to pop that in now, my lovely. There we go. So I can see what's down there. Just going to start scraping away now. Need to grab my paper as well. So now with the endoscope I can see that that's clear. I can see your eardrum looks absolutely fine. So I'm happy with that. Okay. I just need to do a little bit of brushing in a moment just to clean the last little bits. Okay. That's wonderful. But I'll come back to the brushing. So I'll use the endoscope in your right ear and let's see what we can't get out of there. Alright. Here we go with the right ear. Just popping the endoscope in now, my lovely. endoscope all done. Are you alright there? Good. Okay, just get those images saved onto the system. Okay, so I'm going to use this little brush here, okay, and this is just going to gently remove any loose bits of debris, okay? This will tickle quite a bit. Alright, keep nice and still for me again, you've been wonderful. Okay, here we go. Going in with a brush now, my lovely. Is that okay? Good. That's all good. How did you find the brush? It tickled? Good. I told you it would, it's really nice. Okay. Right, here we go with the brush again. That's fabulous. That's all gone. How do they feel now? Good. Right, as a special treat, I'm just going to pop some different drops down, and these are just going to make them feel a little bit more soothed, because they can go a little bit irritated when they've been poked a little bit. Okay, I'll just pop some of these in now and then you won't need any more. I just like to give this to my patients when they've had things going on down the ears. But promise me that you won't pop anything in there, no scratching with your finger or anything like that. Don't use earbuds. Okay, and when you have a shower, just tip your head to the side with a towel to get any water out. Okay, don't go in there with a Q-tip or anything like that. If you feel that you're getting more wax build up again, just come back, okay? Perfect. There we go. Just a couple of these in your left ear. Okay, there's one. And there's two. Good. Good. And finally, just a couple in here. Okay, here's one. And two. So they'll feel really, really comfortable now. I'll just give you a little wipe on each side. Okay. You're all done. Okay. Good, I'm glad that feels better, my lovely. Okay, so like I said, come back if there are any problems. If you start feeling unwell in any way or feel irritated, please come back and see us, but hopefully we won't need to do that again for a while. Okay, well enjoy the rest of your day. It's been lovely to see you. Okay, take care. Bye-bye. Oh, hello there, my lovely. Take a seat and make yourself comfortable. My name's Dr. Sarah, and I believe you're here today for me to take a look at your ears and clean them out ahead of some surgery, yeah? Okay. So you have just some little growths just inside both ear canals that need removing. Yeah. They're completely benign. You have been told this, haven't you? Yeah. Yeah. Okay, that's fine. Right. So at the moment, have you got any ear pain at all? Right, okay. You just get a lot of pressure from the wax build-up. All right. Okay. Feeling generally well? Good. Good. Okay. So I'm just going to grab some gloves and take a little look at you. All right. You don't have a latex allergy? All right. Okay. Let's get these on. That one's broken, so we'll try another one. Sometimes they're a real pain, these gloves. And when you've been wearing them for a while, you just get so sweaty and horrible. And I have to wear them a lot during the day, so in this hot weather it's not pleasant. But here we go, that's better. No broken ones there. Okay, So I'm going to have a little press around your outer ear. Alright, then I'll be looking down the ear before I proceed to clean. Okay, I need to take a little look just to see which method I'm going to use to clean out the ears. Alright? Okay, so I'm going to give the ears a little wipe around first. Okay. Right, I'll do this left ear first. Just a gentle wipe around. Okay. Nice. Good. Okay. And I'll do your right ear now. There we go, all done. So as I said, I'm just going to have a little palpate around the ear, a little bit of tugging on the ear, a little bit of tapping, and just feeling around for any lumps and bumps on the outer part of the ear for now. Okay? Right. Do tell me if anything does feel particularly uncomfortable for you, my lovely. I can always stop. Okay, here we go. Going to pull up on the ear a little bit there. And look behind. Okay. Everything looks and feels fine there. Alright, let's take a look at your right ear now. Pull up a little bit there. Okay, and look behind. Everything is also fine on that side, so we're off to a good start here. Okay, so next I'm going to pop an otoscope down your ear. Let me just turn that on. There we go. And it's got a light which I will just shine down the ear canal to see what's going on, to see how much wax is down there, and to see if there's any other signs of infection. And I can also have a little look at those growths that are going to be removed. All right? Okay, please keep your head very, very still, my lovely, all the way through when I do this. Pop up your hand if you want me to stop, that's not a problem. Okay? Perfect. Right, here we go. Right, so I need to pull up and back on your ear very slightly there. Okay, and I'm just going to insert the otoscope now. There we go. So let's take a look. Okay. Yeah, there's definitely a lot of wax built up down here. Looks quite impacted as well. So I can't really see anything of your eardrum. But I can see the little growth there. It isn't anything to worry about, but we do like to remove them if possible. Just keep repositioning just so I can make sure I've got every angle there. But that's okay. I can't see any signs of infection at the moment, so let me just take that out of there for you now. There we go. You all right there? Perfect. Okay, here we go to this side. Okay, up and back and insert in now. Okay. Okay, there we go. Again, lots of impacted wax on this side also. And a little growth there I can see. No obvious signs of infection or inflammation. Right, let me get that out of that view. There we go, just relax there now. Just update my notes a second. Okay. Right. So there is a lot of impacted wax down both ears. So what I propose to do is to pop some special drops down your ears. Okay. Those are going to break down that wax very, very quickly. You will hear some fizzy, crackly sounds as they do so. It's not painful. My patients love it. They say it's a very pleasant sensation. Okay, so I just need you to keep really still while I do it, and then we'll get to work on breaking this wax down. Then I can start to remove it. Okay, you happy with that? Let me just get a couple of things ready there. Okay. Right. Just have to give these drops a good mix. They are stronger than what you can buy from a pharmacy. You can get some similar, but these are a special formula that we make here just for use in this practice. Okay, they're looking good. Alright, keep nice and still. Just going to pop a couple in each ear. Alright, my lovely? Okay. go then. Here's one. And two. Give that a little rub. Okay. You like the sound? Perfect. Okay, so that's getting to work in your left ear. Let's have a little look at this right one. Okay, so here's one. And two. Just give that a little massage in. Okay. All good. So you're fizzing nicely. Perfect. Right then. So what I'm going to do first, my lovely, is I'm going to use this tool here just to have a scrape around to remove that wax as best I can, okay? Yeah, now, as I said before, please keep still, just pop up your hands if anything is uncomfortable, but I'll be as gentle as possible. Usually these drops are really good at softening the wax straight away, so it makes it very, very easy for me to just pull it out, okay? Alright, so let's go. Okay, just going to go in now with the tool, my lovely, and start picking a little bit. Okay, right, I'll leave that for a moment. Got a lot out of there, so I'll take a look at this side, alright? Just going in with the tool now, my lovely. There we go. Right, I'm just going to have another look down your ears before I decide whether I need to do some more picking or whether I can just go in with a brush and tidy things up. Okay, let's pop that on. Okay, I'll pop it in the left side first. Okay, just pulling up and back again, my lovely, and in we go again. Right, that actually looks really good. I can see your eardrum, so it looks fine. There's no bulging, no wrinkling, it's not retracted. The structures behind are clear and look normal. The growth is visible and it will be easily accessible to remove now. Absolutely fine, lovely. I'll just need to go in with the brush. Okay, let me just remove that. Doing all right there? Perfect. You're an excellent patient. You keep very, very still. There we go. Right, let's take a little look. Yeah, I can now see the eardrum on this side too. Again, perfectly normal presentation. Ear canal looks fine, slightly red from the impaction, but there's no infection there or no sign of any skin irritation particularly. There's no bleeding or oozing, so that's good. Just needs a little brush out. You can see the little growth on this side as well, but again that will be easily accessible when we get you back in for the removal of these. Okay. Right, so for my next trick I've got a very lovely little brush here, okay, and it will just gently remove any excess particles of wax and debris from the ear canal. Okay? Yeah. Okay, just keep still as usual for me, my lovely. Okay? It might sound a little bit loud in your ears, but it's not going to hurt you at all. Okay? Alright. Here we go. Just popping that in now. And let's have a little brush around. else down there with the brush now. You like that? Good. We can't leave the right hand side out now, can we? So let's go in there with this and do the same. Okay, here we go. Okie dokie, that looks fine. Right, do you feel okay? Not dizzy or anything? That's good. Okay, so I'm going to pop another couple of drops down. Actually, I'm just going to give your ears a little puff of air just to get rid of anything that may be on the outside before I put the drops down. Okay? Right, so here we go. You might like this. Okay, right. Put a nice couple of soothing drops down because I've been working inside the ear. This just helps calm any irritation. It won't numb them up, but it just soothes them. Okay, here's one. And two. Okay. Quite nice. Good. Again, just a little couple of pops around. Some lovely soothing drops. There we go. One and two. How are your ears feeling now? Okay? Good. Just going to give them a little massage now with those drops being down there. Okay. There we go, my lovely. So you're all done. and we'll see you in about a week's time for the surgery, okay? Yeah, we'll soon get rid of those little growths for you and you won't feel a thing, I promise. Yeah. If you've got any questions or you're nervous, just give us a call and I can talk to you. Okay? Any problems in the meantime, also give us a call. But I think you'll be fine. Alright? Okay, so enjoy the rest of your day and I'll see you very soon. Take care. Bye-bye.